Hey, what's up? Barnaby here. We're talking about ADHD in this HelloLife moment with my bud, Dr. Jeffrey Chamberlain, family medicine specialist. In previous video segments, we've addressed the issue of diagnosing children with ADHD. But I've got to tell you, I can't tell you how many people look at me and they go, I think you've got ADHD. So adults might have it, not diagnosed as a child, but how would we get at the root of that?
It's a lot harder to diagnose adults and children because they're not captive in front of a teacher for 6 hours a day who's watching everything they do. Adults change situations. Most adults who have ADHD and weren't diagnosed as a kid, usually they're pretty intelligent, and their intelligence is what got them through school with good enough grades and were able to get by. But I see a lot of parents or a lot of adults who say they've gone through school, they're out, they've been working for a while, now they're going back to school, and it's causing huge problems. They're having trouble with the focus or the attention. So a lot of people show up that way. A lot of people, they get the new job, and now they have a whole bunch of responsibility. Instead of doing one task, they have to keep track of a whole bunch of things. And their inattention problems have a hard time organizing everything, and now all of a sudden they're getting fired from their new job because they have a hard time handling it.
Couldn't that just be a simple lack of organizational skills?
Yeah. And it's a combination of things. That's what we have to get to the bottom of. Is this just organizational skills? Is this the normal? I mean, no one can watch a lecture for an hour in a college classroom and get everything that's out of it. So is this just normal? No one can pay attention to this. Or is this something more so than other people the same age? And trying to get to the bottom of this can be a tricky thing to do. It's something we really ask, is this interfering with your life? Is it interfering with things on multiple levels? And trying to get to the bottom of, is this a problem, or is this just something that's annoying?
Right. So then you should look at your ability to concentrate, ability to organize, ability to keep a number of balls in the air. And if you can't do that, then maybe talk to somebody and see if maybe you're firing incorrectly and you're just kind of scattershot.
Exactly. What I do when that patient comes into me, we kind of look at their current history, what's going on, what do things look like when they're younger, because if they had it now, they had it when they were a kid. It's not something that develops as you get older. And then usually I get them formally tested, and we kind of look at a whole bunch of different issues with a clinical psychologist who specializes in ADHD, just to make sure we're not missing something else.
Well, it's interesting because I'm an inquisitive sort. I'd like to submit to the testing just to see, to put it to rest once and for all. Maybe I'm just an antsy sort of a dude. Is that possible?
It's definitely possible. And the other question is, does it interfere with your life? And if you're doing everything you need to do,
right,
then it's really not a disease that you have. It's just more of a personality that you have.
A quirk. Yep. Well, I'll tell you what, it's all interesting stuff always here at HelloLife.net, where we're all about matching your commitment to a healthy lifestyle. In ensuing segments, we're going to be talking about treatments for ADHD. So dive in for that